A new study is shedding light on how depressive symptoms in adolescents may develop differently among boys and girls. Researchers in Singapore analysed more than 900 brain scans from over 500 children. Now, these scans were taken when the children were aged 4.5, 6, and 7.5 years old. The researchers found that some early brain development patterns were linked to later depressive symptoms. Signs include low mood and poor self-esteem for girls, and tiredness and a sense of ineffectiveness for boys. And for more, I'm joined by two scientists from the A-Star Institute for Human Development and Potential. They're senior scientist Dr. Chan Shi Yu and principal scientist Assistant Professor Tan Ai Peng, who is also from the Department of Diagnostic Radiology at NUS Medicine. Welcome both to the program. Now, Prof. Tan, let's start with you. How are childhood brain development patterns associated with depressive symptoms?
So brain development patterns during childhood are linked to the emergence of depressive symptoms because brain networks that support important functions like emotion regulation, stress responses, motivation, and self-control undergo rapid development and organization during childhood. So what is especially important is that these patterns are not the same for every child. Our study suggests that the brain symptom links can vary by age and sex. For example, in the preschool period, girls exhibit patterns which were more closely tied to symptoms such as negative mood and low self-esteem and to brain areas involved in emotion processing. In contrast, in boys, the patterns were more linked to tiredness and feeling ineffective, alongside brain areas involved in decision-making and cognitive control. So the key point is childhood depression may follow very different developmental pathways with different early signs in boys and girls, as well as different symptoms or manifestation at different developmental stages. So understanding this complex pattern can really help us recognize these risks earlier and support children in more targeted ways.
Yeah, and speaking of that support, Dr. Chan, how does this then change our understanding of when depression risks begin to develop? Does it then allow us to intervene more early?
Yes, so depressive symptoms become more prevalent in adolescents, and it's also around the time when we start to see more girls displaying depressive symptoms compared to boys. Because of this, a lot of the prevailing research focuses on the adolescent period and puberty. However, there is evidence showing that the risk factors for depression are different in males and females, and some of these are already present in childhood. So from our study, we show that vulnerabilities from variation in brain development already exist in childhood. We showed that brain changes between ages 4.5 to 7.5 years are associated with depressive symptoms at age 13 years old. This brings up the possibility of identifying individuals at risk for developing depressive problems at an earlier age, ideally in late childhood before severe symptoms manifest. And this earlier identification increases the time window for intervention.
Right. So, Prof. Tan, let's go back to you now. The study finds that boys and girls, they follow different developmental pathways towards depressive symptoms. Why are girls 2.5 times more likely to report these symptoms?
So I think basically it also has something to do with the age range that we actually examined in this particular study. So basically, we actually evaluated for the emergence of depressive symptoms at age 13 in this particular study. So actually, previous studies have already shown that girls actually manifest depressive symptoms more often in adolescence. So this is really not surprising. The highlight of our study really is the fact that we identify that these differences actually occur way from preschool ages. And that actually provides us an opportunity to pick up these early warning signs and actually intervene early so that we could prevent the ultimate manifestation of these depressive symptoms in adolescents.
Now, Dr. Chan, going back to you now, talking about intervention, the study also suggests that depression doesn't develop the same way for everyone. So how does this affect the types of treatment that can be administered or even how patients are diagnosed to begin with?
So in this case, for our study findings, it's more relevant to the diagnosis part of it. So because we identify that there are different developmental pathways to these symptoms, it implies that there are different risk factors in males and females. And so this would also imply that if you would like to screen for these behaviors, you will be slightly different. You would expect different behaviors in males and females. And so this makes a case for the development of sex-specific screening tools.
Now, Prof. Tan, what do the study's findings then mean for parents who are listening to these findings? How can they use this information to provide more support when it comes to their children's mental health?
Okay. So perhaps before I address your question, maybe I can add on a little bit to your question with regards to the intervention. So as Dr. Chan mentioned, that basically our study focused a lot on identifying early signs for screening and diagnosis. And I also want to clarify that our study does not imply that boys and girls should automatically receive completely different care. But what it really does suggest is that the assessment and support that we give to children should be more personalized. For example, if a child is identified to have more impairment in terms of self-esteem or motivation, then the support that we give this particular child will be very different to another child who presents with like ineffectiveness or lack of focus. So coming back to how parents could actually make use of the findings that we identified in this study. So I think one key message that I would like to put through is that childhood depression can be actually very different from adult onset depression. So the way that they manifest can sometimes be very subtle compared to adults, whereby they are characterized by loss of motivation, lack of interest, and low moods. In children, they can actually present with more subtle signs, like they could feel tired most of the time, or they can have inability to focus on daily tasks, or they may not be able to make friends because they have low self-esteem. So I think it is very important for parents to be aware that depressive symptoms can manifest in varied manner in children, so that they could actually be more cognizant if they do actually see these early signs in their children.
Now, Prof. Tan, before we go, just want to know what's next when it comes to further research that you might be working on based on these findings. What more do you hope to discover and delve into when it comes to the mental health of children?
So the important next step really is that in this particular study, although we actually perform brain scan in a large number of children, but we would definitely like to do further validation to see whether we would actually observe similar findings in different group of children. And we would also like to extend our study into later age group, into mid and late adolescents. And I think another area that we would really like to look at is that now that we have identified that different brain development patterns could lead to depressive symptoms, it would be very important for us to see what kind of early environmental exposure could actually impact these developmental patterns. So for example, looking into screen exposure, the sleep pattern of children, this would help us actually implement early intervention strategies that could prevent the occurrence of brain changes that could lead to depressive symptoms.
Well, Prof. Tan, Dr. Chan, thank you so much for sharing your insights with us today. That was a senior scientist, Dr. Chan Shi Yu, and principal scientist, Assistant Professor Tan Ai Peng from the A-Star Institute for Human Development and Potential.